Let's talk a little bit about bacterial meningitis. Bacterial meningitis is an acute inflammation of the meninges and cerebral spinal fluid. Now that we have vaccines, we've seen a drastically reduced incidence of bacterial meningitis in the pediatric population. Risk factors for bacterial meningitis include lack of immunizations, recent exposure to someone with a pathogen known to cause bacterial meningitis, penetrating head trauma or even recent surgery, or really any way that there is a path for bacteria to enter the brain. This includes anatomical defects. The most common route of infection in bacterial meningitis is bacteria that originated from somewhere else and passed the blood-brain barrier into the brain. Common pathogens that cause bacterial meningitis include Hib, Streptococcus pneumoniae, and Neisseria meningitidis. In the infant who's less than 28 days old, we typically see group B strep, E. coli, and Listeria. Also keep in mind, you can get viral or even fungal meningitis. Clinical manifestations of meningitis include manifestations of systemic infection, as well as manifestations of irritated meninges. For the first, you can see fever, chills, headache, vomiting, and seizures. New onset seizures in any child is very concerning for meningitis. However, with irritation of the meninges, you can see photophobia, nuchal rigidity, or positive Kernig or Brzezinski signs. Infants with bacterial meningitis will exhibit poor feeding, marked irritability, and a bulging fontanelle. In addition, like we talked about in other videos, they may have a high-pitched or neural cry. While nuchal rigidity is possible, it is very difficult to elicit other signs of meningitis in infants due to their age. The diagnostic evaluation of bacterial meningitis includes a full septic workup. This includes a lumbar puncture, which is the definitive diagnostic test for finding bacteria in the CSF. We're going to culture the CSF to find out if there's bacteria, and if there is, we want to identify them and also test them against common antibiotics. In the meantime, we can also do a gram stain, obtain a blood cell count, which also includes glucose and protein levels. Management of the pediatric patient with bacterial meningitis includes placing them in isolation. We want to initiate antimicrobial therapy as quickly as possible. Like we talked about with other neuroprotective care in previous videos, you want to make sure that we maintain hydration, nutrition, and adequate ventilation. We also want to make sure that we decrease ICP. As we talked about before, this can include control of seizures, controlled temperature, decreasing stimulation, and properly positioning your patient. Our approach to antimicrobial therapy in bacterial meningitis includes beginning with broad-spectrum antibiotics, which we can then later narrow based on the culture results. You can see here in this table the recommendations for broad-spectrum antibiotics by age. In addition, it also lists the most common pathogens responsible for bacterial meningitis. More nursing care for meningitis, like we talked about before, includes keeping the room as quiet as possible and decreasing environmental stimuli, such as the lights. You want to keep the head of bed slightly elevated, and also watch your vital signs, neurologic exam, and urinary output closely.